Hi, this video is about Tinel'S sign. Tinel signs mean actually directly uh, pins and needles sensation which is felt at the distal distribution of particular nerve. When it's tapped exactly at the trunk, what does it mean? What does it resembles? You know very well, when there is any compression or damage to a particular nerve, there will be regeneration of the nerve and which leads to demyelination. And after a while, especially after 28th day, there will be regeneration of that particular nerve and the remyelination will be there. So what happens initially, there will be compression or damage to that particular nerve at a particular site. So there will be degeneration of that particular nerve, especially the demyelination occurs initially uh, towards the proximal closest end, but it will be very fast to the distal area where the nerve is actually injured. So after a while, after some 28 days, when it is starting to regenerate or regrow or regenerate, uh, we try to tap the nerve course of that particular nerve. So when you are tapping, when you feel any tingling sensation or pins and needles like sensation, pins and needles like sensation means it indicates there is some nerve injury. Okay, and when you feel any tingling like sensation, it indicates there is some regeneration. Especially when we are closing, going deeper into that, we can say when you tap at a particular point and you feel and you feel tingling sensation distant to that particular point where you are tapping. For example, you are tapping here and you are feeling some tingling sensation distant to that particular point. That means it indicates there will be compression of the nerve loop and there is regeneration. That is right. If you are tapping at a particular site where the nerve is actually injured and you are feeling some tingling sensation over the distal area, that indicates the nerve is actually successfully regenerating. Suppose if you are tapping at the particular point and you are getting that tingling sensation not distally, and sometimes very rarely you would feel the sensation proximally. This is very rare and sometimes it happens. We call this one as reverse Tinel'S sign. So when you are seeing that particular sign, it indicates there must be complex regional pain syndrome. Okay, so when you are tapping at a particular point, if you are feeling the tingling like sensation distal to that particular area where you are tapping and along the distribution of that nerve, that indicates the nerve is successfully regenerating. But if you are getting it reverse, that means proximal to that particular area where you are tapping, that indicates it is a complex regional pain syndrome. Suppose sometimes, very rarely, if you are tapping at a particular point, you can feel that tingling like sensation which is present only that particular area itself. It will not be in the distal and it will not be in the proximal also. It will be present only at that particular area itself. It indicates there is a blockage. For example, neuroma. There will be some blockages. If there is any blockages or neuroma, so that the sensation which cannot be carried out to the proximal or distal, so that the tingling sensation or the particular what the pins and needle sensation which will be present over that particular area where you are tapping. For example, I'm going to say some entrapment signs. For example, carpal tunnel syndrome, we can tap it in the wrist region. And medial wrist joint, medial elbow joint, if you are tapping and you are getting that sign means this is area to get uh, cubital tunnel syndrome. For example, uh, if you are tapping for median nerve, you have to tap at the wrist joint. It indicates the carpal tunnel syndrome. If you are getting the positive sign, it indicates carpal tunnel syndrome. For ulnar nerve, you have to tap in the medial elbow. It indicates cubital tunnel syndrome. For example, for ulnar nerve, uh, there is some other area also we can tap. That is in the wrist. Wrist region also you can tap. When you are getting some tingling sensation while you are tapping at the medial elbow, that indicates this is cubital tunnel syndrome. Suppose if there is no sign, but you are getting the same tingling sensation or pins and needle sensation when you are tapping the ulnar nerve at the elbow region and you are getting the symbols, signs means it indicates Guyon's canal syndrome or else ulnar tunnel syndrome, Guyon's tunnel or ulnar tunnel syndrome. And when you are tapping at the medial ankle and you are getting the same sensation, it is a test for posterior tibial nerve. We call that one as tarsal tunnel syndrome. And for common peroneal nerve, we have to tap it at the fibular head, that is in the lateral knee joint. Fibular head, you can tap. Suppose if there is any positive sign, it indicates peroneal nerve compression or peroneal nerve entrapment or peroneal nerve syndrome. Okay, thank you.